What's going on, everybody? This is Dr. Kenyon Hackworth from Healthy You, Wealthy You, where my focus is on improving health and building generational wealth. If you're new to the channel, make sure you subscribe and hit the comment button or comment and hit the like button. Today, I have a very special guest, and we're going to be talking about eye care. I have Dr. Shaynora Brown, who's an optometrist. So, Dr. Brown, thank you for joining me and welcome.
Thank you for having me. It's a pleasure being here to have this discussion with you.
Yeah. So, can you tell me a little bit about yourself, where you're from, and how did you get into optometry?
Like you mentioned, my name is Shaynora Brown. I'm an optometrist currently here in Houston, Texas. And I am originally from the Bahamas. Was raised there, lived there all of my childhood, and I figured out I wanted to be an optometrist in about grade 12. Um, uh, and so I did a year of college back home in the Bahamas, and then I moved to Houston in 2010 to pursue my undergraduate degree as well as my optometry degree, which I completed at the University of Houston. Um, what really got me interested, what got me started is kind of the concept of not being able to see. I'm fortunate with good vision for now. And so I'm the oldest of four sisters, and my sister that's right after me, we're pretty much about the same age. We're very close in age, and she struggled with her vision very early on in life. So I can remember my mom being pretty much bothered by the fact that my sister wasn't doing well in school. She was being ridiculed at school about it. And she noticed that when she would check her notes or check her schoolwork, that she was not writing down and copying down her spelling words correctly. So, of course, she was studying from something that was inaccurate. And so my mom took it upon herself to set up an appointment with an eye doctor. Being an educator herself, she kind of had some idea of what to look out for with students. And so we went to this visit with an eye doctor, super foreign for me, super foreign for my sister. But I remember in that examination room thinking, why can't my sister see? She's absolutely lying. Like there's no reason that she can't see and read what's on the board. And I remember being so like kind of confused as to how my sister tricked the eye doctor into getting glasses. Obviously grew from that, realizing that she needed the glasses really bad. And then we had another sister that was born. Similarly, she had vision problems. And at that point, when I would go to her visits to see the optometrist, I grew more curious, one, because of the fact that I've got two sisters that do struggle to see far away. But what is all of this in here? What's this equipment? What are these tools that he's using? How is he helping my sister see? And so as I grew older among the years, I started to do more research about it, learn a little bit more about the eye, the career in general, the balance that comes with it, but more so fell in love with how important our eye health is and what can be done in just a simple visit and seeing your eye doctor. And so that was basically that got me started. I came here and started pursuing my undergraduate degree in biology. I worked as an optometrist assistant and kind of grew and learned more about the field there and like how to manage, do some testing, which helped a lot when I did start optometry school at the University of Houston. So that's what got me into it. I'm still pushed by that, the fact that people have such varying types of vision, how they see, what affects their vision. And I use myself as a comparison and understand that blessing, but I do like that I'm in a position where I can give people the level playing ground of being able to see, for the most part. So bringing their vision back or clearing up their vision, correcting their vision is a better way to say it, so that they can see what I see.
I know that's awesome. I think that's one of the important things that is that most people don't really think about eye care, something that is on the top of the list. It's like lower down the food chain, if you will. And it
Yeah.
took your sister having vision problems to actually get started. So
Yeah.
when should people start? I have three daughters. I want to make sure that I'm not waiting until they have vision issues. So when should someone start getting their eyes checked?
Yeah, so to get formal, the AOA recommends, so the recommends an eye exam actually for an infant. So 6 months to 12 months, the first eye exam. You can find providers that provide those services under the Infant C program. You can Google it and they'll give you a list of providers. But for the most part, a lot of that in this setting in America, they kind of catch if an eye exam is needed when they, do their newborn screenings and things like that. Now, this is if you've got a healthy baby, no complications, nothing's going on, no complications at birth. Premature babies, they're getting their eye exams pretty much while they're either in NICU or, within their first few months of life. But I know that can be hard to do as a new parent, that first year of life, getting adjusted. My recommendation to anyone that I tell is before they're starting school. And that can be before pre-K, before kindergarten, because you want to make sure that there isn't any small things that is kind of affecting how they learn. So obviously we use our eyes to focus to see, but tracking, attention span. So a lot of these things kids don't know how to voice to us. They aren't able to tell us if they can see or not because they've only had their eyes since the day that they were born. So it's a good idea before they start school to get them in to see an eye doctor.
Okay. And then also nowadays, there's a when I grew up, we didn't have phones, we didn't have screens. So
Yeah.
are there any different things that they recommend as far as screen time? And because it's almost like trying to like a death knell, trying to pry screens away from my daughter's hands. So
Yeah.
put that phone
We
down. So
yeah, we're definitely recommending the least amount possible.
Mhm,
Now, if we've got babies, toddlers, that age, zero at all is really good.
mhm.
Nothing, there's not a need for it. I like to think back to when we were all introduced to it. We were kind of all introduced to it with our kids. And so it was fascinating. It was fun to see these very, very young kids, pull out an iPad, unlock it, know my code. And I know even growing up in the computer generation, um, uh, the fear of us not being able to keep up with technology. But now we know for a fact that there's no hindrance there if you
Mhm.
are waiting to introduce those things to your kids. If anything, it's better, especially when it comes to their eyes, even their sleep. Everybody's worried about blue light and exposure in that way. As far as it comes to the eye, we don't have any substantial evidence that shows that there is damage to your eyes per se, but we do know for a fact that you can suffer from eye strain from all of the near task, looking up close, being on phone screens and devices. So less is more. And beyond it being just, we can say maybe an hour a day to 2 hours a day, depending on the age of the child. But that's not continuous.
Mhm.
So that is spread across the entire day. I recommend to my patients that every 15 to 20 minutes, we got to get off that device. We've got to reduce that near work, do something else, go play, go outside, and break that up so that they're not getting the eye strain. Because even if we're doing an hour a day, if we're just going 1 hour and straight through, you can still have those eye issues. We've also found, and studies have supported that kids that spend more time outside, outdoors in the sun, tend to be less nearsighted than those that don't. So it's not a cure, it's not reversing, but there's something about outdoor play, which, if you think about it, we're mostly using our distance vision, is reducing that risk of us becoming more and more nearsighted. in that way.
Plus, being in the sun helps your body because sun you get vitamin D. That's the sunlight vitamin.
There's a lot of positives, but of course, we want to make sure that we're protecting our skin
Yes,
with
exactly.
sunscreen and our eyes, sunglasses or brimmed hats, those types of things too. So
Okay, yeah.
yeah.
So I definitely need to get me some new sunglasses for the summer coming up.
Yes,
So
yes.
so now also now you talked about the vision aspect of it, but vision is not the only aspect of eye care. Is that correct? So looking at the
Absolutely.
eyes, is there more to it than just checking someone's vision?
For sure. Me putting somebody in glasses is literally less than 5 minutes, a minute, 2 minutes on a day. So that part of it isn't the hard part. The eye exam itself is assessing everything. So your visual efficiency, how you're focusing, but even more in depth, we're physically looking at your eyes. We're looking inside. We're looking to see how your nerves are, how your blood vessels are. And in most cases, primary care physicians are wanting you to have that done, especially if you have family risk of certain systemic conditions like high blood pressure, diabetes, thyroid conditions, even autoimmune conditions, because there's some medications and drugs that can affect how you see. So outside of not being able to see, an eye exam is not just for that purpose. It is a part of your health exam, just how you get your body checked. We're now moving into an era where we're checking on our minds. We want to make sure our mouths, our teeth, our bones, our eyes, everything is, in order. And so skipping out on those exams is not recommended at all, just because you feel that you have good vision.
Mhm.
With certain eye diseases, you can have 20/20 vision and still be legally blind, because we're also assessing your side vision, your peripheral vision, and things like that. So, yeah, very important to make sure that you're getting your eyes checked routinely.
I know one of the diseases that we often talk about that really has an impact over the entire body is diabetes. And I know
Yes.
that diabetes can cause neuropathy, it can cause pain down the leg. People eventually sometimes end up having to go through amputations. But I
Hmm.
also read about diabetic retinopathy and
Yeah.
how that affects the eyes. Can you talk a little bit about that?
Yeah, when we're getting to those devastating stages of complications with diabetes, diabetic retinopathy is one thing that can affect our vision. And that is, I believe it's still the leading cause of preventable blindness in the US. So, essentially, what's going on, diabetes in a nutshell, as you mentioned, it targets all areas of the body. But when we have high sugar or uncontrolled sugar, it damages the eyes, it damages the blood vessels in the eyes, and it creates a state that's not getting enough oxygen. So when that's happening, we've got our body now producing in our eyes these new blood vessels. Sounds like a good idea, right? More blood vessels,
Hmm.
more blood, more oxygen. No, those blood vessels that are created are very weak, and they're they're non-specific. Um, uh, and so those weak blood vessels will break very easily, and that will lead to bleeds and swelling inside the eyes. And that's what causes the vision loss. We should not have blood loose inside of the eyeball, right? If we're
Hmm.
talking about something that needs to let light in to a clear path, anything that's in between there is going to disrupt it. And blood in itself, where it's not supposed to be, it can be toxic. And so when that happens, we have to go through even more extreme types of treatment. Of course, for sure, we're always trying to control the diabetes, because if it's not controlled, it's just going to keep happening.
Hmm.
But we have to do laser surgeries to help put it in control. And this is unrelated to LASIK. This is not helping the vision. This is basically trying to prevent the eye from continuing this process of creating more blood, creating more swelling. We also have to do injections into the eyeball. Yes, injections. None of those procedures are comfortable. But like I said, this is something that in most cases can be preventable, especially when we talk about type 2 diabetes. So, for one, if you know that you have that family history of diabetes, or you yourself are diabetic or borderline, you should be seeing an eye doctor every single year irregardless of the status of your vision, your perception of your vision. Because when we do our dilated eye exams or when we take photos inside of your eyes, we're able to get a view to see if we see some bleeds or some swellings. And in most cases, if it's caught early on, we can control it and save vision. So yeah, diabetes is one in a lot of cases where patients have devastating effects. Also, cataracts. Cataracts happen a lot faster in diabetics as well. So, yeah.
And what exactly is a cataract? I'm not sure exactly what a cataract is and how does it develop from diabetes? And also, if you don't have diabetes, can you develop cataracts?
Yes, very good question. I always ask my patients after I inform them that they have cataracts if they know what it is. Everyone's heard the term.
Hmm.
But cataracts is it happens as a natural aging process for our eyes. So all of us will develop some form of a cataract if we're here long enough. You know, if we get to a certain age, we're going to start seeing it. But what's happening is inside of our eyes, the lens that helps us to focus, to see, it gets cloudy over time. Just naturally, when it's growing, it's naturally over time from the day that we're born. It's also filtering UV light, and those processes cause it to become cloudy. Typically, that cloudiness starts affecting our vision late in life. So we're talking about 60 plus, even 70. I've got 80-year-olds with, barely any cataracts. Everyone's a little different, but we don't expect to see it in young patients. But if you are diabetic, it's more likely that your cataracts will come a little bit sooner. I've seen cataracts as early as in a 25-year-olds. That's probably the youngest patient that I had to date.
Wow.
So that's happening because of those high glucose levels are affecting
Hmm.
the processes inside of the lens that and it's making that process just happen faster. Simply as I can put that. Um,
Okay.
uh, but if you have something that's clouding inside of your eyes, same thing like we mentioned with the blood, that's what's going to lead to the vision loss, the decline in vision, and the blindness. It is something that we can take care of a lot easier in most cases, but um, uh, having a cataract removed at a young age, it gets a little bit trickier when it comes to correcting your vision. It can be a little bit more pricier
Hmm.
as well. But yeah, we can all get cataracts, but those diabetic ones, they're a lot more tricky, a lot more messier.
Yeah. Now you talked about the cloudiness. Is that something that you see when you're looking into the eye, or is that something that we see looking out where our vision starts looking cloudy? Or is there a particular symptom that we look at, or is it just something that you find through your exam?
Both.
Okay.
So as the patient, if you have a cataract, you're going to notice a decline in your vision if it starts to become visually significant. So
Mhm.
typically they will complain more of glare that's not corrected by their glasses. Um, uh, uh, Nighttime is a little bit more difficult for them to see, or reading in low light settings. They need more light. It's a general haziness that does happen.
Mhm.
Um, uh, but for diabetics, it can seem a lot more like it happened all of a sudden.
Okay.
Typically, for the aging cataract, that's happening gradually over time. So it's not as noticeable until it gets to the point that the glasses aren't working. But we can tell you and inform you about those beginning cataracts and kind of make you aware to what to look out for from our examination. So I will look in and I will see in depth the layers of your lens and what part's cloudy and what type of cataract you've got going on. However, most times, kind of 9 out of 10, a person from the outside won't be able to look at you and say that you have cataracts.
Mhm.
I know a lot of my patients will refer to other things on their eyes, other cloudiness on their eyes, and call it a cataract. You probably can't see it. Especially in today's society, most people are taking care of their cataracts before it gets to the point of maturity and pretty much total blindness. Every now and then I may have a out of town or out of the country patient that does have pretty dense cataracts that you can see from the
Mhm.
outside. But yeah, most times you're not going to be able to tell just by looking at someone that they have cataracts.
Okay, so one important point that you said, I want to make sure that all of my listeners get this, is that if you are diabetic or pre-diabetic, make sure that you're going, because it's a large population of
Yeah.
us that are
And family
diabetic and
history of
pre-diabetic, yeah,
diabetes as
or
well.
yeah, or
Yeah.
family history. Make sure that you're getting your eyes checked every single year, because it's very important to make sure that you're doing everything from a preventative standpoint and not
Yes.
waiting to this until something happens. And you talked about every year for people who are diabetic or have a history of diabetes. What
Hmm.
about for people who, let's say, are not diabetic or pre-diabetic or don't have that history? How often should they go get their eyes checked?
So, they've actually updated some guidelines, and if you are in glasses or contacts requiring any type of correction, we
Mhm.
still want you to come annually, so every single year.
Okay.
Just because we know there's some other new influences that are not necessarily threatening vision, but kind of threatening our vision comfort. So dry eye disease, digital eye strain just from being on devices. So we want to make sure that you're best corrected and you're not suffering from that. If you don't require any type of correction, meaning that you went to the eye doctor and they said, you have good vision and your eye health is good, you don't have any of the other risk factors that we discussed, like diabetes or any systemic condition. So anything that you are taking medication for or being monitored for by your physician, then we can do your eye exams, I would say, every other year. So try not to go beyond 2 years. Um, uh, because we're trying to move into this preventative model, right?
Hmm.
Just because we're feeling good, we want to make sure that physically we're doing well. And that's why we're going to the experts. We're going to the eye doctors and the specialists. But any type of systemic conditions annually or as recommended by your doctor. So and your eye doctor as well. So like sometimes if you may have high blood pressure that is not displaying any signs inside your eyes, but you're still in the a point that you're trying to control it or it's still a little high, then they may recommend to see you like every 6 months or every 3 months, just depending on that. So 9 times out of 10, you're gonna get at your exit on the conclusion of your exam, when should we see you back? So I try to make
Hmm.
sure I discuss that with my patients so that they know that, we want to see you back to make sure your eyes are still healthy.
And I like the whole aspect of the preventative model
Yeah.
for everything in general in healthcare, because like you said, you can be feeling good, but it's not about necessarily how you feel. It's about what's going on the inside of your body.
Yeah,
Because a person can be feeling good and 20 minutes later they have a heart attack. So
exactly.
that's why hypertension is the silent killer, because you don't have
Hmm.
symptoms for a lot of different stuff. And
Yeah.
you mentioned dry eye disease. So if
Mhm.
someone has a dry eye, it's probably not a good idea just to be pumping Visine and what's the other, clear eyes in the
Ah.
eyes every single day.
Yeah. Oh my goodness. You never want to mention those drops to an eye doctor. So first
Please
and
explain,
foremost,
because I know that a lot of people just use them all the time.
yeah, no. So essentially, dry eye is a chronic condition. It's a term that encompasses a lot of things, and it can happen for many reasons. Because of that, you definitely want to visit your doctor so that they can assess to see if if you're needing a certain type of treatment. But going back to the drops, so essentially, lubricating eye drops are not a problem, but there are certain brands that are out there that we don't recommend.
Mhm.
There's so many eye drops on the market, so many, so many. But when you're looking for an eye drop, you want to make sure that you're not getting a drop for eye redness. Eye redness, a lot of times, those drops that focuses on making your eyes look whiter, brighter, um, uh, can sometimes be kind of masking a problem, an actual issue, and we want to make sure that we're treating that right away. But a lot of them have a rebound effect. So essentially, if you're using it, the more that you use it, you're gonna get the redness back, and it's just a cycle. It keeps going. And that's because a lot of the drops like Visine and Clear Eyes, they have an ingredient that vasoconstricts. So it causes the blood vessels inside the eyes, the white part of your eye, to go smaller. So if you've got smaller blood vessels, the eyes look wider, brighter. But, that can only last for so long. Your blood vessels do have to dilate again as a part of their function. But if that's happening enough, one, your eyes may no longer actually respond to that medicine as it should. And it, like I said, if you have chronic red eyes, we need to address the problem. Is it just dryness? Is it allergies? Do you have an eye infection? Especially if your contact lens we're at risk for vision loss at that point if our eyes are getting red and they're not getting any better. So rule of thumb is if you're getting redness and it's not going away on its own, visit your eye doctor. Definitely if there's more symptoms like pain, vision loss, that's more of an emergency visit where you want to call them and let them know and see if they can see you as soon as possible. But lubricant eye drops, not to necessarily vouch for certain brands, but a lot of my colleagues can agree that we're okay with things like Refresh. Refresh is a good brand. Sustain is a good brand. TheraTears is a good brand. There are some drops that have been pulled from the market, which is another reason why I would recommend before you put anything in your eyes to find an eye doctor or a provider that can look at your eyes. Worst case scenario, you go to an urgent care. And I say worst case just because, yes, they can treat it at an urgent care, but some urgent cares don't have all of the tools to properly assess what type of eye problem you've got going on. But starting there, and they can recommend you see another eye doctor if need be, or maybe recommend some eye drops as well. But for sure, if it's eye related, hurting the eyes, find an eye provider. We're everywhere.
No, see, and that's so important. I didn't even realize there were so many different brands. I didn't even think about you guys is what you thought about eye drops. You go in and you see them in a convenience store.
Yeah.
You say my eyes are dry, my eyes are red. Let me just put these in my eye. But even more, I think one other color that might be even more detrimental is not just the redness, but when your eyes are yellow. Like if you have
Yeah.
jaundice from a liver issue. Have you seen any of that in your practice? Well, I
I
guess I should see
have.
what age group you normally see patients. I know typically when someone has yellow or jaundice is associated with liver problems. I know
Yeah.
it shows up a lot with people who are alcoholics or chronic alcoholism.
Yeah.
So,
So yeah, hepatitis, things like that. Yeah.
mhm,
So I don't see it tons. However, the setting that I work in, um, it just depends. It just depends. A lot of times if we're getting yellowing of the eyes, unless you're suffering from alcohol addiction, most of
mhm,
those patients are probably, if they're older, they're probably getting some type of treatment by their doctor because we're talking about really, 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 really severe liver disease and things like that. So a lot of times, like I may mention it to my patient just to see if they're aware of it, and they let me know, and we review, which is why it's also important when you go and see your eye doctor that you're giving your full history, your medical history, because those are things that we look out for and we monitor, and we may refer you if we see certain signs. So even things like blue sclera as well as another thing that we look out for that can be associated with certain connective tissue diseases or like
mhm,
autoimmune conditions. But yeah, we don't see it much, and that's also something that they look out for whenever newborns arrive as well. But for the most part, I think um uh patients that are in that category, in that group, unless they're suffering from chronic alcohol addiction,
mhm.
or homelessness, things like that, they're getting it treated. Yeah.
Okay.
And I will say that as the population, we're very, very concerned about how our eyes are and the color of our eyes. So I get
Mhm,
patients all the time that are concerned about, why aren't their eyes bright white, things like that, or the pigment that may happen on our eyes, which For the most part, it's never really an issue. If we've got, we can have freckles on the white parts of our eyes. The more melanin we have,
Mhm.
the more likely we're going to have pigment, not just on the white part of the eye, but the color part inside the eyes as well. But just as we monitor those freckles and spots on our bodies, we just make sure those same things aren't happening. But of course, if anything is new, looks funny, looks strange, another reason, just pop into your eye doctor and ask about it. And we can look at it up close and make sure that it's nothing to be concerned about.
Yeah. So, and this is why it's so important to have you on here today, because most of the time when you think about eye care, most people just think about vision. And
Yeah.
for me, that's what I've thought about most of the time. Just
Hmm.
the vision aspect of it. Okay, I can see well. I don't think I need glasses, so I don't have to go to the eye doctor. But it's so
Yeah.
much more. And I'm glad you came here to explain this, that it's so much more to getting your eyes checked and just seeing how your vision is and how you can see. And we talked about cataracts.
Hmm.
Another disease that pops up I hear a lot about is glaucoma. Can you
Yeah.
explain what glaucoma is and how it affects people?
Yeah. So glaucoma, another silent killer, or silent taker of vision. So glaucoma is mostly a nerve disease.
Hmm.
And what I mean by that is that we get this thinning in our nerves that is usually commonly caused by higher eye pressure in the eye. It's not
Hmm.
the only way it can happen, but most times we've got a high pressure in our eyes, not blood pressure per se, but and because of that, it creates an environment that's choking the nerve and causing it to thin. And it causes us to lose our peripheral vision first.
Hmm.
So when you hear about the terms tunnel vision, that's what's going on. Why I say it's a silent killer, or silent taker of our vision, is because for the most part, our brain does a very, very, very good job at using both eyes and putting together a clear image. It's always working. That's what it does best because it quiets any noise so that we're seeing as best as we can. So when we start getting mild peripheral vision loss, it's going to be pretty much ignored or suppressed by your brain. Not until it starts getting to the point where it's affecting both eyes, because traditionally with glaucoma, it's asymmetric. We've got one eye that may be a bit more advanced than the other. And when both kind of get to a point where we've got significant nerve damage, that's when we start noticing the vision loss there. So that is actually the eye disease that I referred to earlier, where you can have 20/20 vision, but be considered legally blind because you've lost so much peripheral vision. And that's
Hmm.
important just for movement, mobility, knowing if somebody's moving, coming up on the side of you and things like that. Um, uh, Now, there is another eye disease that affects our vision. It's called macular degeneration. It's also pretty common as well. But that one affects your central vision. So that one tends to be a lot more noticeable. But with glaucoma, we do have treatment options. We've got lots of treatment options, where from eye drops to surgeries, some surgeries using laser as well. But the goal in that is usually to try to get the eye pressure down to a point where it's not causing progression of that nerve thinning. So another reason, another reason that you should get your eyes checked. And from my experience with my patients, most people value their vision more than I feel like. I feel like if I were to ask people if they would rather lose a limb versus their vision, they would go up, they would lose their limb over their vision. So and that's why it can be so sad when we get to a point where we're at very bad vision loss and now we're coming to a provider, and this is something that could have been prevented because now we're trying to do everything to save your vision, and we can do a lot, but we can't replace an eye. We're not
Hmm.
there yet. So that preventative and seeing your eye doctor. But most of us, if you haven't seen an eye doctor in 2 years, you should be picking up your phone and making a call to make an appointment. So it's important just from a body and health perspective for sure.
Yes. Make your eye appointment today. Don't
Yes.
delay. Call today. Make your
Yes.
eye appointments. And so I was at a restaurant. You know, in the restaurants they have these lightings that can be kind of dim, and
Yeah.
some people can't really see the menu. So
Yeah.
it was a group of us, and one person left their glasses, and they really couldn't see the menu, so they turned to somebody else and said, "Hey, let me see your glasses." But I was
Hmm.
thinking to myself, I don't really know if that's a good idea because their vision can be different from yours.
Yep.
Somebody can be nearsighted, somebody can be farsighted.
Yeah.
Is there can you just take somebody else's glasses and say, let me see yours for now, or is there something that they have to make sure that they're doing? And the differences between, let's say, somebody who's nearsighted and somebody who's farsighted.
Okay. Yeah, no. So what you're talking about is kind of like that area when we venture into presbyopia. So remember how I
Mm-hmm.
mentioned that I don't need glasses yet?
Mm-hmm.
Most of us that have never needed glasses or worn them before later in life typically starts in our 40s, but by 45, 50, we start to notice that our up close vision isn't what it used to be.
So you're telling me
And
now I'm getting close. That's what you're telling me. It's like
yeah,
I'm reaching
well, I
this.
mean, we all getting close, one day at a time, right? So, when that starts happening, we need additional help to see up close, to focus up close. Now, in that scenario, it depends. If your friends just needed reading glasses only, so we may have all seen inside of a drugstore, the dollar store, a pharmacy, that they've got like the lineup of glasses with a plus one, plus two, all these different powers. So if we're somebody that either wears contacts, so we're fully corrected for our distance vision, or we don't need correction for far away and we've gotten into that area, reading glasses are okay. Now, we do need different strengths, but if we're in our, the same friend group category, we're probably around the same age, you probably can manage with their reading glasses or cheaters. Some people will call them cheaters. However, prescription glasses, no, we don't want to share those.
Mm-hmm.
We can have prescriptions that are close, but remember, we're working with two eyes. And the chances that each of our eyes match up with somebody else is kind of like a fingerprint. And yeah, there are some cases where somebody's prescription may be similar to another person's, but I see it all the time where, oh, I was using my mom's glasses, my brother's glasses. And I will say, yes, sometimes I am grateful for the patients that may do that after I've checked, if they're very nearsighted, their prescriptions never match. But, if they're driving, I'd rather them have something versus nothing. But our bodies and our eyes, our brain will let us know if those glasses are going to work for us in no time. You'll get a headache, eye strain, you're still squinting. You never want to use somebody else's prescription glasses because it can cause more eye strain just from doing that. And it can make it harder for you to get adjusted to your prescription once you get your glasses. But yeah, readers, cheaters,
Those are fine.
those are fine. Those are
Mm-hmm.
fine, but they don't work for everyone because, like I said, if you do require some type of correction, especially if you're farsighted, you may need more power than somebody else or less power than somebody else. But the lucky thing, oh, you were asking about the differences. So we covered presbyopia, which is
Mm-hmm.
just as we naturally get older, we lose our natural focusing ability to see things up close. But we've got myopia, which is known as nearsightedness, and then we've got hyperopia, which is farsightedness. So we're used to the terms nearsightedness and farsightedness. Gets very confusing, but the way I try to remember this is when we talk about sightedness, so what we can see, we want to consider that. What can we see, right? So sightedness. So if we are nearsighted, we can see things that are near to us. So I can see up close. That is myopia. That's what most people kind of think of when they think you need glasses. I can't see something that's far away. I can see up close, no problem there when I read, but far away, it's a problem. You're nearsighted. I'll get glasses to correct that. Farsightedness is the opposite. It's a little bit trickier. So farsightedness, our eyes work harder to focus things closer to us. It doesn't necessarily mean that you cannot see up close, especially when we're young, because when we're young, that's what we can do. We can see up close, we can focus. But somebody that's farsighted may need some help when they're younger, not tons. They might kind of outgrow that prescription a little bit, don't really need glasses in their 20s, 30s. But once they get to their 40s and presbyopia hits, it adds on to it. So remember, we said farsightedness is our eyes work harder to focus up close. Mm-hmm. Now we've got that aging part that happens in our 40s. So we've lost that ability to keep things in focus up close. And that's when we start needing reading glasses or glasses full time. So most of the time, patients that are farsighted don't need correction unless they are, older, or their farsightedness is so much that it's affecting their distance vision, and that can happen. And then we have the all-star that everybody's afraid of, astigmatism. Mm-hmm. Big word, nothing to be fearful of for the most part, because most of us have some astigmatism. So with nearsightedness and farsightedness, we're talking about, in general, how we see the shape of our eyes, right? So in order for us to see, light has to come from out here, enter in through our eyes, and land at a very specific point in there in order for the brain to receive it. And so if we've got differences in how our eyes are shaped, that can affect where that light focuses. So when we're nearsighted and farsighted, we're talking about how long or short your eyeball is. Sounds crazy. It's not that exaggerated, but those small differences affect where light lands, right? But when we talk about astigmatism, we're talking about the shape of the front of the eyes, your cornea. And so in the cases of astigmatism, we don't have perfect symmetry. There's some differences there. And as we all know, symmetry is not necessarily a normal occurrence in humans. We've got one eye that might look a little bit more open than the other, or an eyebrow that's not as perfect as the other. But they're very, very, very close sisters, maybe fraternal twins, right? Mm-hmm. But when we talk about the shape of the front part of the eye, that's the first surface or the first thing that light enters. And so it plays a big role in where that light's going to focus. So if we've got the front part of the eye that's shaped a little bit differently, it's not perfectly round, then we also have an eyeball that is a little bit longer or a little bit shorter. That's going to affect how that light focuses and if that information is going to get back to the brain as blurry or clear. As simply put as I can put it. Mm-hmm. And that's why you might hear some eye doctors compare it to like football shaped versus soccer ball or basketball shaped. Like I said, it's not as exaggerated, but we do have some cases where there are eye conditions where we can have severe asymmetry in the cornea, and that can cause high amounts of astigmatism. And in those cases, yes, we can have more detrimental vision. But for most of us, our astigmatism, our nearsightedness, our farsightedness can be corrected with glasses and contacts.
So one of the things that I always talk about, and I always expect people to do, I always tell people, is that you have to go every single year to get a physical. That is very, very important, because you don't know what's going on with your body. It's important to go every single year to get blood work, to get checked, to make sure everything is going on. So now I really understand, and I hope everybody understands how important it is to make eye care an intricate part of your annual physicals and getting checked from that particular standpoint. There's one thing that I just thought about that I don't really see a lot of, and that is optometrists of Black or African or Caribbean descent. So I'm just curious, in your graduating class, you graduated from Houston, how many students were there, and how many students were Black or African or Caribbean descent?
So when I was attending the University of Houston, kind of around 2014, not too long ago, my class size was about 100 people, give or take. And I was the only Black student in my class.
The only one?
The only one. I mean, even the classes above me and below me until I graduated, they had one, maybe two students of color.
Do they?
I yeah, it's our percentage in this profession is about 3%. So that's Black African American descent. It's only 3% of us in the US. So
That's a
it,
very small.
we're rare. We are very
Even me, like in chiropractic, it's a very
yeah.
small 2% of us the same way. Do they? Are there any recruiting things? I think you know what's very important for me. I think is that when your patients come in and they see you and they see
Yeah.
somebody that looks like them, and they're able to say, well, "This is not just from a standpoint of as a patient, but then it
Yeah.
opens up their mind to say, well, maybe I can become an optometrist." So you might strike
Yeah.
the nerve in somebody who you can change their whole outlook of what they might want to do when they grow up. So, it's great to have to see you and see more people of color in doctor being doctors in general, but also it's really good for the patients to see.
Yeah, no, I mean, I'm sure we've all experienced it, as providers, whenever we do get patients that look like us, you can almost see a change in their
Hmm.
expression, almost like sometimes a weight lifted off their shoulders because they're just, it's like they're more comfortable. Not saying that they aren't comfortable with other providers, but naturally in our community, we do have a lot of hesitation when it comes to healthcare just because of history and things along the way. But so it always feels great to be that representation, especially when I do um, uh, I mean, all ages. I've got, older generations that are just so proud to see me here,
Hmm.
and they're recommending their patients to come and see me. But I now recently work in a pediatric population. So it warms my heart more for little Black girls, little Black boys when they do see me providing healthcare for them. I can feel that it's like an unspoken kind of vibe, energy, like, which is why you need a provider, because if like
Hmm.
it's
Hmm.
just you can tell that they're more comfortable, because you look like their parents, you look like their grandmother, right? And so even with the parents, they're happy to see me there. And so representation does matter. I've come across, even in my journey of becoming an optometrist, a lot of people that I'm studying with in undergrad that, are also pre-health, looking into different healthcare aspects. And when I tell them like, oh yeah, I'm pursuing optometry, they're like, I've never thought of that. I've never considered it, and it is something to consider, but just any type of healthcare aspect, because it can make a world of a difference for our community when we've got each other and we can provide that care. So I personally try to look for providers that look like me, just because I can.
Hmm.
We're in a place where we can have that choice and we can look for different providers. It is very tough too, but knowing that, and not saying that providers that are not of this ethnicity, not of this race, can't do a good job. They absolutely can. But I think that support and us being able to do that and see it more is going to push more of us in that environment and create just a better space for us to be healthier and hopefully wealthier as well, because that definitely works together. If you're not doing well in your body, you're either spending money to take care of it or you're less productive. So definitely. And I try my best to be more representative. I'm looking forward to in the future, getting out there, visiting us, doing career days, things like that, so that um, uh, they know that this is how an eye doctor can look. This is how a chiropractor looks. You can do it. I've even had little girls of different ethnicities, different races, and I remember this one patient, and it caught me off guard because I'm used to it, being maybe a little Black girl or that might be inspired and so interested. But she really, really was so excited that I was her eye doctor because I was female, because I was a
Uh,
woman.
hmm.
So, just diversity is a good thing across the board because it's just the little things. The little things matter, you know.
The little
Uh,
things matter. That
so
is so true. The little things matter. This
mhm.
was fantastic. This is fantastic. We covered a
Yeah,
lot of information. I thank you for your expertise. I learned a lot today. So hopefully everybody learns a lot, and they don't just listen, but they take action. That's the number
you
one
do
thing. You have to take action. You have
exactly.
to take action. I know I'm overdue. I have a physical coming up, and I'm
Hmm.
going to make sure I get my eye visit checked scheduled
Yeah,
right after that. So
absolutely.
again, I want to thank you so much for joining me today and using this platform that I'm trying to build for education and helping to educate so many people about the importance of eye care. You're so I'm proud of you, you know,
Thank you.
as a black female in your journey, and I want to continue to wish you the best and wish you a great influence over a lot of people, and just go out, continue to be great, continue to serve, and thank you for joining me. And if you have any last words, you can say so to anybody listening, or I just thank you so much.
Yeah, no, thank you so much for having me. This has been really nice, really good. And I know and I we're gonna have the reach that we need to, but I hope it's exponential. We know, you know, that it carries on four generations.
Yes.
But you know, my last words are schedule your eye exam. You know, they'll let you know if it's time if you have insurance, or even if you don't. Nobody's gonna turn you away. So and then for sure those physicals, let's not forget about that as well. But yeah,
Awesome.
thanks for
All right.
having me.
Thank you. Have a great day.
Yeah.